living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Many people take care of your health needs. One way to ensure you get better, safer care is to make sure all healthcare providers and healthcare settings have the same information. In a world of electronic health records, this is possible through Health Information Exchange, or HIE. Welcome to Healthy Living for Life, show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back to Healthy Living for Life. Joining us to talk about HIEs is Dr. Monica Berner, President of Blue Cross Blue Shield in Montana. Thanks for being on our show, Dr. Berner.
Well, thank you for inviting me, Sarah.
What is an HIE?
Well, it's really a fancy name for what I see is an extension, a modern extension of how we manage health records. All of us can probably remember when we've gone into our doctor, and I remember as a physician, dealing with paper charts. And if your physician didn't happen to have your chart when you came to your visit, they didn't have any of your healthcare information available. And then over the past 10 to 20 years, most clinicians have transitioned to electronic medical records. You see the doctors and the nurses and their staff working on a computer. I mean, that's just the natural progression of how we manage information, not just in healthcare, but across the spectrum. What people don't necessarily recognize is that all of that clinical information is trapped within a particular electronic medical record that is proprietary to the clinic or to a hospital. And it's very difficult for us to share then that clinical information from one hospital to another or one provider to another if they don't have the same electronic medical record. So the Health Information Exchange is essentially a highway that allows us to share that clinical information electronically from one system to another.
So there are different kinds of health information exchanges, right?
That's right.
And they're not all statewide.
No, there are not. As you can imagine, larger healthcare systems, if they have different electronic medical record systems within the hospital compared to the outpatient clinic, perhaps they need a health information exchange even within a university or a larger system so that their clinicians can share that information. Sometimes a local community has decided they want to be able to share that information. Some of them are within a state, across a state. So there are a number of ways that organizations can come together and decide to share the clinical information.
So give us some examples of the types of information that might be shared in an HIE.
So again, I would go back to kind of the anecdote of imagine sitting in your doctor's office and the doctor says, you know, I'd like to perform a chest x-ray or a particular lab test. And you say, well, doctor, I just had that 2 months ago with someone else across town or even across the state. So if you're a patient in Helena and you've been seeing a specialist in Billings and that specialist had ordered that test, your physician in Helena does not have automatic access to that test. So they're either going to have to call the physician in Billings and ask them to send it or fax it, or ask you to go to Billings and get an electronic copy on a CD or a printout copy and bring it back. So Health Information Exchange essentially allows at point of service, your clinician to access that clinical information. So it's all clinical information. It is lab results, it's chest x-rays, it is recommendations from your specialists, it is surgical notes, it is a list of your medications so that when you go in to seek services, your clinician can have a full 360-degree view of your clinical condition when they're seeing you.
So I tested the concept of an HIE with some of my friends and asked them, you know, do you know of what an HIE is? Have you heard the term? And they hadn't. So is it really that new?
No, it's not that new. It's new in Montana, I will say that. But there are at least a dozen or more states that already have health information exchanges up and running. And as I mentioned earlier, there are integrated health systems that have them up and running. We attempted to put together an HIE here in Montana several years ago, and due to the newness of the technology, it just wasn't successful, because an HIE essentially has to integrate with each individual system in each individual office and hospital. And so the technology has really come a long ways in the past 10 years or so. It's time for us here in Montana to begin to look at it again, because it is up and running in other places and working very well and positively impacting patients' health.
So you talked about Montana having an HIE a few years ago.
Yes.
So what is Montana doing now as it relates to an HIE?
So what Montana is trying to do we've put together a group of clinicians and healthcare payers and patients and folks from basically every facet of the healthcare continuum, and said, how can we come together collectively to create a health information exchange that we believe would be valuable and that we can all trust and feel comfortable with to facilitate better care across the state. And in doing so, we've created an organization called Big Sky Care Connect. And it is just a fledgling organization, but it has a representation from across the spectrum, a number of leaders, and currently we are in the process of selecting a software platform that would support a health information exchange and be deployable across all of the hospitals here in Montana.
So when you say a software platform, tell our listeners what that is.
So my expertise is clinical, and my expertise is not IT. I will confess to that right away. But I imagine, so when I think of it, what I imagine is trying to connect an Android phone to an Apple phone. And you've got a number of different systems, and they store the data in different ways, and they have different repositories, and you have to have a system that connects those two types of phones. And that's really what we're looking at from a health information exchange perspective. You're looking at a system that can connect multiple electronic medical records and then store that information so that it can be extracted and used.
Thank you for that information, Dr. Berner. Coming up next, we're going to take a deeper dive into how HIEs can mean better care for patients. Stay tuned, we'll be right back.